All right. Welcome, Ellen, to Collab Conversations. This is season 3, episode 2, I believe. I'm so excited to get to know you and to understand what you're doing. And I'm especially looking forward to learning more about AskEllyn.ai, I think. So I will let you tell us who you are, what your story is, your origin story, and then I guess we can get into the Ask Ellen afterwards. But tell us about who you are and how you came to be
Yeah.
here.
So, well, first and foremost, I'm a mom of two, a grandmother of one, and I have been a professional communicator pretty much most of my life, doing PR and writing work and that sort of thing. And I've had a focus on tech. And then 3 years ago, actually this week, 3 years ago, I got a phone call from my doctor and I learned that I had breast cancer. And, it's kind of the classic story, doing self-checks, found a lump. I had already had a mammogram booked. And so the doctor changed that to be a diagnostic mammogram and an ultrasound. And, they say bad news travels fast. And I think I was home from the breast clinic for about an hour and the doctor's office was calling, and I had 3 tumors in my left breast that were all BI-RADS5, which is the radiological indication that it is highly probable it's cancer. So I knew basically that it was cancer. And ended up having a double mastectomy, went flat, which is a whole other story in and of itself. They had found that the cancer had gone in microscopic. They found it in microscopic amounts in my lymph nodes when they sampled those. So I ended up in chemotherapy. So I'm the poster child for chemo curls. And then did 4 months of 12 weeks of chemotherapy and 15 rounds of radiation. So, all told, it's kind of, almost the balance of a year was spent, going through cancer treatment. And so I'm, now 2.5 years out from finishing my chemo. And yeah, it's been a bit of a crazy ride. And my life has changed completely in very unexpected ways since that diagnosis.
And do you mind elaborating how it's changed
Yeah,
completely?
I sort of thought I'd stop there because I actually call it, if you're familiar with something called the butterfly effect, in the butterfly effect, for those who don't know, it's really, it started back in the 1960s to describe weather phenomenon, but it's been sort of adopted in new ways now. But it's this idea that there's this innocuous thing that happens, a brush of a butterfly's wing, that for whatever reason starts to create a ripple effect. And all of a sudden there's a tsunami that's like crashing on the shore in another part of the world. So it's just insane. And that's exactly what's sort of happened in my life. So again, I was diagnosed with breast cancer, first time really in the medical system, other than having babies. And I approached it with a sense of curiosity. And I embraced a concept called amor fati, which means love your fate. And I realized pretty quickly on, as I was going through this, that there was so much I didn't know. I didn't know anything about breast cancer. That happened to other people. I didn't know about women's health and how raw a deal we get. Um, Even the language that they speak, in terms of like the words they use to identify different types of breast cancer. Like I felt like I would wandered into like a Starbucks where I didn't understand what a macchiato with whip and foam and pump and all that. I don't speak Starbucks either. And so it also lit in me this passion to want to help and to bottle up my knowledge and all the work I did and pass it on to the next woman. So where things started was I wrote a book, and it's called Flat, Please Hold the Shame. It's not really about me being flat. That's just part of my narrative, but it was really meant to just be a simple story about a woman going through a diagnosis and treatment. And I wrote it in the first person so that the person that was reading it really felt like that they were going through it with me. And the idea was really I wanted to just hold somebody's hand. And I hate the words, you got this. I think that puts a terrible amount of pressure on people. So I never use that phrase. But I will say to somebody who's been newly diagnosed, we're here to hold your hand.
Mhm.
And that's what I craved, was that companionship. So I wrote this book while I was in chemotherapy. And I literally thumb typed it on my phone, hepped up on steroids, as I was going through it. And I, in fact, ran out of material. I was in chemo. I went to see my doctor, told her I was writing the book. It was August, and I had run into myself on the journey. Like, I had told the stories up until that point. And I remember saying to her, I've run out of material. She said, oh, we'll give you more material. So finished the book, and it was sitting in manuscript form. And I was trying to figure out when I was going to publish it. It's on Amazon, so I was self-publishing. And I had missed October because I was still in treatment, which would have been the natural time to kind of publish something like this. So I thought maybe I'll do it on Mother's Day. In between that time, and this is a crazy story, again, the butterfly effect. In this crazy sort of period where I was sitting with the manuscript in public, in just in unpublished form, I ended up bumping into a fellow on a conference call, and nothing to do with breast cancer at all. I think there were two women on the call who were commenting on my hair because my hair was growing back at this point. And that piqued his curiosity, and he started asking me questions. And I mentioned that I had had breast cancer, and then I had written this book. And he said, well, why? And I said, well, I wanted it to be a girlfriend's companion guide. And he thought, that's really interesting. Why would you not just go to support groups and things like that? And I said, well, when you join these support groups and you're in cancer or you've been diagnosed, you are wading into collective trauma. And not everybody likes to engage in these support groups either, nor do you have the time, frankly. You're already like rushing between appointments and trying to keep going with your life and everything else. And he was intrigued by that. Unbeknownst to me, the whole world of AI had blossomed, and ChatGPT had come out, and he was experimenting with that. And he was sort of had this belief, which I now have the belief as well, that AI is going to profoundly change humanity. And so to get him back off, on track, I sent him my manuscript. And he, in 3 weeks, took my book and recreated it as a digital version of me. And that is Ask Ellen. And so she knows my story. So think of her as this perfect blending of all the knowledge of the world that is contained within a ChatGPT, but then married with my book, which shares my story, my personality, my way of talking, my knowledge of the world, my knowledge of breast cancer. And it's this merger of the two. And then we applied guardrails on top of it, which are really important to understand.
Mhm.
So we set rules for Ask Ellen. First, she's non-medical. So you can ask her medical questions and she will answer with my lived experience, but she'll always guide that person back to their care team. And so that's really important. And for that reason, clinicians actually love her. She is private. So there's no registration. We don't collect any personal information about that individual. I always say it's like a Catholic confessional, and there's no priest on the other side of the wall. So you can say anything to her. You can go and you can rage at her. You can ask inappropriate things. Nobody's going to be listening. We do collect the questions people ask, but we use AI to anonymize them, and then we actually rephrase those questions. So you get the gist of it, but you don't get the actual words. And that's really just so we make sure that she's answering questions in the
Yeah.
correct way. And then she is free. So the open version of Ask Ellen, we were very aligned on this, that we never wanted a patient or a family member to have to pay to use her. That just had a huge ick factor for me. For $9.99, you can talk to my chatbot. That was just not going to happen. So I launched a nonprofit associated with her when we brought her to market. I'm now learning it's a lot harder to get funding for a nonprofit. And so I'm still figuring out how we actually continue to fund this and keep it going. But I've got a bunch of irons in the fire. And the other really cool thing about her is because of OpenAI, she speaks every language. So you can literally talk to her in a Yoruba, which is a Nigerian dialect, or Bulgarian, or Mandarin, or she even speaks a smattering of Indigenous languages. And that I didn't realize was as important as it is, because we have a very diverse patient population now. People who are newcomers, people who do not have English mastery, uh, who are also potentially from a culture where breast cancer is still a very shameful diagnosis. And the thought that I can be there for that person to speak with them in their own native language, and that it is private and confidential, and they can be, so the thought that she's a companion to some woman who may be shut down by their own family because of their diagnosis is a pretty amazing and remarkable thing for me. Yeah, so we brought her to market in October of 2023. So she's just about a year and a half old now. I've layered on a blog on top of it, and so now, in addition to the chat, people from the breast cancer community can join the blog. They can contribute their stories, their wisdom, and so it's really starting to morph into the world's first lifestyle brand for breast cancer.
Yeah. I have a
And
question if you don't mind me. So I find it so fascinating that you've like created this chat bot like based on your life experience. And I'm wondering like as more people are like getting on Ask Ellen and they're asking the questions and they're like having that conversation, because essentially you are having a conversation.
yeah,
Are those life experiences also being used then to like when other people come in, like because your experience might be different than, somebody who has cultural shame related to a breast
right.
cancer.
Yeah. So she's always, so it's really interesting. And I've had this question come up a lot. Like, does she become this amalgam of stories? And I maybe someday in the future, I actually secured Ask Her with this idea. But what I don't want to lose, and so I haven't gone that route yet. So it's not like we draw in experiences into her brain. So it's only information that I feed her, I choose to feed her, and it's based on my
Mhm.
experience. So what I don't want to lose is the intimacy of talking to a friend. And so I can sit down with a friend of mine who has endometrial cancer, and we still understand each other. Like, because the emotional journey and the gold standard of treatment of cancer, no matter what kind of cancer, usually involves surgery, chemotherapy, radiation. So that experience is pretty common, and it's universal around the world. And so really it's about you sitting down and talking to a friend that may not have your identical experience, but there's this empathy. There's this sort of knowledge and understanding of what you're going through. And it's really that emotional response that is so important. Where I can bring in other experiences is through the blog. So I can,
Yeah.
talk about fertility, or I can talk about someone who's stage 4, because those are not my experiences, but then they can share. And so it kind of opens up that way. What I do anticipate, and I'm already starting to see the sort of signs of this, is we're now getting approached by other change makers who want to create these chatbots like this and do it for other cancers or other diagnoses. And so we have an Ask Shan, the company that partnered with me to build Ask Ellen has now created Ask Shan, which is based on a woman's experience around an early diagnosis of Parkinson's disease. We have an Ask Ashley, which is for caregivers of individuals with dementia. There's soon to be an Ask Eve, which is built by, get this, a 16-year-old for early stage menstruation. And we have an Hi Eddie, which is built by, again, a 17-year-old, which is for eating disorders. And so this idea, I have this vision that there is this entire new category called conversational care, where AI can infuse the lived experience of an individual who is the expert, that patient is the expert, and brings that into the care journey. And so it would just be like a colleague that, when you go through cancer and you get your surgeon and your medical oncologist and your radiation oncologist and you get your nurse navigators and people like that who dealing with the medical stuff. But then you'd have this like empathetic companion who's just there to hold your hand.
Yeah. And so, okay, one of the questions I was gonna ask was like, how does this translate into other tumor sites, and then also other diseases.
Yeah.
But I mean, I guess you're able to help them build the AI platform based on their experience, because you wrote a book and then used that
Yeah.
to
So,
build.
since we sort of launched, that guy that I had met that built the first Ask Ellen, he's gone on, he and his colleagues now, they have their own business. It's called Gambit Technologies or Gambit Co. They just recently just shifted their name a little bit. And so Gambit Co. is now building this platform that creates these chat bots or chat agents, but they have personality. They actually have a real human's personality built into them. And so that's what's really cool is they can enable this, and they're really passionate about helping change makers as well. And it's just this notion of support at scale. Like, I have like 2,500 followers on my Instagram account, and if someone is diagnosed and they reach out to me, there's been times where if they're really shattered, I'm like, let's get on a call together. But I can't do that in every language, and I can't do that. I mean, I only have so many hours in the day to do that kind of stuff. But I'll tell you a story. Again, we don't know who's using Ask Ellen because it's private, but we have a little feedback mechanism, and so people can toggle that if they want to talk to us. And so we got this message, and it was from a woman. This was back in June, and she said, "I want to thank you for what you built." And she said, "I just want to share with you that I was taking I'd had my surgery, and I was taking a shower, and I was going to see my scars for the first time. I was taking my bandages off." And she said, "I was really anxious about that, seeing my new body." And she said, "I want you to know I used your AI, and I talked to her, and I found out we had a lot in common." Kind of funny. She's like, "I knew you were athletic, and I knew that you had a D cup." And she said, "You got me through that moment." And I thought, wow, the fact that I was able to digitally stand with this woman and hold her hand in that moment in her bathroom. No nurse, no doctor's ever going to do that. No family, most family members won't be present for that. And
Hmm.
just that thought that I got her through that just fires me up. It keeps me going, and I know that what we built is important.
Yeah. And I mean, no family member, no doctor, no nurse will be able to do that, but also no patient advocate would be able to do that either. And just like like there are only a certain amount of hours in the day and a certain amount of languages that we can speak. But how do you see Ask Ellen as a tool? And I don't know if it's like, is it a tool that patient advocates can also use to help with their patient communities? Is it like, is it a complement? Is it like, have you thought about that?
Yeah, I have, because I don't think that support communities and patient advocates are going to go away by any means. I mean, but we have been solving this problem with humans. So, if you look at like the American Cancer Society, they're training non-medical, oncology patient advocates, and they're humans. And it's wonderful, and those programs exist. Or, you go to a US insurer and you're diagnosed with cancer, you might get like a behavioral health consultant or a nurse navigator who's assigned to you, or you might get, you know, but it's dependent on volunteers. It's expensive to do that. Again, maybe those people might speak French and English, or they might speak Spanish and English, but they're certainly not in one human being going to speak every language known to man. And so what I see is this is support at scale. This is a way of solving for that problem in a new and unique way that is also going to unlock the potential to deliver support in other countries in the world as well, where they're not as resource rich as North America. Um, and I was just looking at data from Ask Ellen. I mean, the majority of our visitors, probably because it's my influence and it's all just going word of mouth, but its majority is from North America. But we've actually been accessed in 50 countries around the world. Like, I had
Wow.
a gentleman reach out the other day who's been diagnosed with pancreatic cancer, who was on Ask Ellen and said, "I'd love to build something like this for pancreatic cancer." And he's in Australia. Like, it sort of blows my mind. I get these like people reaching out to me, and they're from other parts of the world, and they're like, "Hey, I just chatted with her in, you know, Dutch." I'm like, oh, okay, you know. So that's really, and then in October we found out there's an organization out of Geneva called the City Cancer Challenge. It's backed by like the UN and the WHO and World Bank and a whole bunch of these big boys. And they're launching so their mandate is to try and deliver cancer care to low to middle income countries and to do it in a different way and to utilize cities like through a municipal network. So they have 15 cities around the world that are participating in this initiative, and they launched a digital patient navigation library. So 11 tools that they'll be deploying to different parts of these cities in different parts of the world. And AskEllyn is one of them.
That's amazing.
I know.
Congratulations.
Yeah,
Yeah.
it scares me because, again, if, Sao Paulo, Brazil, and women getting diagnosed in that city, which is massive, start, speaking Spanish to AskEllyn, there are costs associated with running this thing. So
Yeah.
I'm hoping that some of the partner network will step forward and give this lady in Cambridge, Ontario, some help in making this vision possible. So
Yeah. I mean, I hope that people who are listening to the podcast will be like, "Oh wow, this is such an incredible idea. Let's get her some resources." But
yeah, I mean, there's 2.3 million women diagnosed with breast cancer around the world every year. There's 7 million of us that are out there surviving. The other important thing to know is that she's not just for the patient. So for every person that's diagnosed, there's 10 others around them, family, friends, children, that husbands,
yeah.
lives that are just shattered, right? And so she has this ability to perspective shift, so you can go to her as a husband and say, how do I support my wife going through this? Or she actually even has this ability to not only speak different languages but to sense the level of language competency. So you could talk really sciency to her, or you could actually talk very simply like a child would. So if you typed in why is mommy bald? She looks silly. She's going to answer back in this like really loving, motherly kind of way that's just so sweet. And so you could see somebody using it as a cancer coach. We've had people go to her and ask Ellen advice on curating a gift basket for a friend. I've used her myself. This is very weird, very meta, but when they start, looking at you after you've been diagnosed with cancer and they start doing the bone scans and everything else, they had seen spots in my lungs and my liver, and they were able to rule the liver out. And then they wanted to check on the lungs a year later. And the uh, intellectual part of my brain was saying, Ellen, they're not waiting a year if you have lung cancer. But the emotional of me was going through anxiety and going, oh my God, I got to get back into that CT scan again. And so I went to ask Ellen while we were building her and asked her advice. And she said just the right thing, just the right thing to me, which is
Yeah.
like surreal, but cool.
That's really amazing. I mean, so I'm looking at it, and obviously, I'm not a cancer patient, so I obviously bring a different lens to different things that are happening in the landscape, and I can see this as a great tool to help with shaping policy
Yeah.
and for access and reimbursement and all that stuff. And so I'm just wondering, I mean, the data is obviously anonymized, but have you thought about how you can utilize that to help? And I guess, with the different advocacy groups or the patient groups who are in the space, this is a really great way that you can work together because you can really help change the landscape for breast cancer women, not just in Canada, but
Globally.
yeah, exactly.
Yeah. I mean, we have, I certainly, it's crazy, how this butterfly effect takes you in places. Like I am now, on first name basis with a whole bunch of like esteemed radiologists around the world. And I've had, conversations with the National Comprehensive Cancer Network. I think, I think this will happen in time. I really do. It's just, I'm one lady trying to do this right now, part-time, because I have a job and I have to make a living and doing it. I think I've done a pretty good job of getting myself out there, but AI is still very new. And there's a lot of really, interest, like a lot of interest from organizations. So GE Healthcare is a big fan of what I'm doing, but they don't quite know what to do with it. And, I've had conversations with, very senior folks at AstraZeneca who are very intrigued by what I'm doing. But, it's just all very new for folks. And this category, this sort of patient as an innovator, patient, this empathy piece, they all kind of know that they need it, but they've never really thought about it this way. So there's a little bit of kind of get people getting their heads around this, but I think in time it could be amazing. I'm also very conscious that I'm dealing in healthcare. I don't need a provider. Um, like they're not going to buy this, but I do want them to recommend it to their patients. And so I want to play nice with them, hence non-medical. I call myself healthcare adjacent. Um, but I also understand that world is, in the clinical world, is very much driven by clinical evidence. And so it's not complete public knowledge, but there's a very prominent Canadian agency who is going to be funding a clinical evidence study led by researchers at Brock University and working with researchers at Queen's and UW and University of Waterloo. And so we're going to be looking at AskEllyn and conversational care and its impact on patients and caregivers and marginalized communities as well. So yeah, and I'd love to see more of that. I'd love to see research happening outside of Canada as well,
Yeah. Well, I think there's also and I don't want to limit it to patient preferences, but so I think there's an health technology assessment agency in Europe that is using social listening to help provide that patient input into their deliberations for when they're making recommendations to
yeah,
reimburse drugs. So this could be like a great tool that provides that kind of information. I'm
yeah,
thinking, like you mentioned AstraZeneca, how you're having conversations with them. Well, couldn't they, as a pharmaceutical company, also go in and be like, "Hey, Ellen, like, y what would you like to see in a new drug development?" Or like, what are the things that I
yeah.
mean,
No,
I don't know, like,
she's a sounding board. I mean, I have some clinical advisors that I've brought on, including the chief medical officer of oncology for GE Healthcare, and they see the potential, especially if we can grow this to have other cancers represented, that this actually could be used as a training tool by, like the College of Family Physicians, um, you know, because empathy is something that is, I think, a great deal of importance. And I don't think it's fair to ask a clinician to have empathy, because compassion, 100%. 100% compassion for that patient, but empathy implies that you've actually had that experience. And so this is a way for them to actually immerse themselves experientially in, like, get into the head of a patient and
yeah,
how they're reacting and feeling about things at that particular moment. And the open version of AskEllyn, which is, the one that's available on AskEllyn.ai, is, it has the blog and everything else associated with it, and, the book and all the AskEllyn brand. But we do have the ability to, so the chat itself is a separate object, and it is licensable. And so that is something that I'm looking at as well, because there's so many different scenarios there. So yes, we could spin up a private version that could be that where we could collect data, with the permission of the user. But imagine this sort of, it moves outside of that kind of artificial construct of the research world, where I don't know, people get surveyed or whatever, or even a focus group or whatever. It's just, there's this artificial construct and people kind of are on their best behavior, where if it was more natural conversation,
hmm
I just think some really interesting data would come out. We have the ability to actually trace that to a location. So it's not impossible to do that. The other thing that we have been talking to some folks about is, could AskEllyn be a resource guide? So I can add to her knowledge. Okay. So I'm, continue, my life continues to go on. So my story continues, but I can also make her the smartest lady in the room about things. So we could teach her all about, um, you know, resources that are organizational specific. So imagine a Ask Ellen that is specific to the Mayo Clinic. And so someone is diagnosed with breast cancer, they come to the breast program at the Mayo Clinic, and they're sort of greeted by Ask Ellen, who's this warm, empathetic, person who really gets what they're going through and can emotionally connect with them at 2 o'clock in the morning or whenever they need her. And she's there for the family as well. But then, based on the questions you're asking her, she could say, hey, did you know we have this program here? Or this is going to happen over here. And so we can kind of turn her into like this little, uh, you know, like a traffic cop of some sort. I even have this idea that she could be, available to a workplace, and again, be a coach for patients, for family members who are going through cancer,
For
or
others.
colleagues and managers who
Yeah.
don't know how to resource plan or say the wrong thing to somebody in
Yeah.
a meeting or make these assumptions that people either can or can't work. Like I always say, you want to hire somebody who's had cancer because they're tenacious and resilient and badass and all the things that you want in an employee. So yeah, so these are all things that I'm kind of like exploring and thinking about, but it's just it's all takes a lot longer and is a lot, harder to break through.
Yeah.
So,
And so, I mean, you're thinking about it, but does Ellen do this now? So if somebody is on and asks, Ellen, I live in Sh Shawinigan,
yeah, 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 yeah.
and I would like to connect with a patient group that speaks French.
So
Um,
so the open version doesn't,
okay.
but she could. Right? So because it's private, we don't necessarily know. So we can add whatever we want into her, as I say. So it could be like if we wanted to do a Quebec version of her, right? Like the breast cancer group in Quebec. A version of this could sit on their website, and we could load it in with all kinds of resources that are Quebec specific if we wanted to. So, or they wanted to. So, I mean, that would be the licensing model that we would explore. But yeah, that's where I would like to see things head. I mean, I have this dream that every person that's diagnosed with breast cancer, every family member has access to this, um, wherever they are in the world. And so we have the ability, like, to incorporate links and things. As to say, the open market version, and the one that people are working with right now is well called V1. The platform has evolved that the guys have built, and she's not yet been migrated over to this other platform, but it's got a whole bunch of new resources and new capabilities. But she's working great today for the purposes of what we need her
Yeah.
to do, and so
Yeah.
uh, it's
But I
not going to.
really love this licensing model, like to be able to go to the Quebec Cancer, Breast Cancer, and they're amalgamated, but we'll just say the Quebec Cancer, Breast Cancer Society
Yeah,
or group, and
yeah,
have them, like have it built specific to their population with, well, the Quebec population with resources
yeah,
for those people living in rural Quebec,
right.
in like
Like,
city, in like Montreal or wherever, like big
yeah,
cities. I mean, I think that that's amazing.
right, and
And
that's like, so the guys at Gambit, this is not related to Ask Ellen, but the one that they built for caregivers of dementia, they did that with a state down in the United States, so it's geo-specific to North Carolina. You can go to her, but you can't access her because you're not in North Carolina. But she has the ability to, like, she's resource aware based on geography. So you can go and ask her things and she'll point you to resources in your local city or town or whatever. So that's all that the technology's there to make this possible.
yeah,
And yeah, but it's again, I think people are very, they're very like, well, is this an app? And it's like, no, it's not an app. Or, AI, ooh, that's scary. What if she goes rogue and says something? And honestly, we did a global webinar with GE Healthcare a year ago where Dr. Gipp, who's the chief medical oncologist, interviewed me in a fireside chat. And he also interviewed the third panelist was Ask Ellen. And so they went live asking her questions. I thought it was amazing because our responses were like so close. He would ask me the question, then he would ask Ellen, and it's like, it really is me talking. Even has my sense of humor. And that has to be able to do that. GE Healthcare, who doesn't even let a PDF out the door without, massive rigor. So they hammered on this thing, from a compliance and a legal perspective. So we're quite confident that she does not break those guidelines that we've put in place, those guardrails around being non-medical. One of the guys that built her just actually showed her to a guy who's an AI expert at the FBI who tried to break her and couldn't. And husbands love to talk to her. They try and break her all the time. And we've said the most unkind, most inappropriate things to her as in our testing, because you don't know what people are going to ask or how, but she's always gives a very dignified response. I always joke and say that they built a better version of me. Like she doesn't lose her temper. She doesn't go rogue. So I suppose I've just put a challenge out there for somebody to try and make her do that. But
So I actually was gonna say it would be fun if we could do like we could have Ellen live, but then I realized that it's a podcast. And
yeah,
that
well, I mean, if it is a vlog, I have done that. I have, but yeah, people can just go and talk to her and, as I say, experience the blog as well. Like there's women out there, like it's just wonderful to see women reaching out and wanting to kind of impart their knowledge. And again, I don't want to look at this I really want to change the narrative. When you look at portrayal of women with breast cancer out there in the media and everything else, it's like we always look sad and pathetic and scars on our heads. And,
yeah, exactly.
women are thriving. They're badasses, and so that's what I want to celebrate. And, with everything that I'm doing, I really want this to be a place of encouragement and positivity. And it may not be okay. I never say you're going to be okay because I don't know that. But I want to, even people that are diagnosed with stage 4 cancer are living hard, And so I really want to look at breast cancer from in that full lifestyle perspective. So fashion and fitness and yes, things about treatment and disease that's in there, but I don't want to be the WebMD dupe of breast cancer. This is more about the experience. So
and I guess maybe one last question or just a couple more questions, but we're seeing the face of cancer is changing. So there's a lot of younger women who are getting diagnosed with cancer and breast cancer specifically. And so, I mean, I imagine that their experience when they're getting diagnosed is going to be much different than your experience when you got diagnosed. So how does Ask Ellen, like with this changing landscape, how does Ask Ellen respond to that?
So I think that from an experiential, again, she's just this friend. So she might be like a big sister to that woman. She's not necessarily going to have had, some of the, like how, following Katie Thurston right now is a bachelorette, who's just diagnosed with breast cancer, and she's going through egg retrieval right now. So that was not my experience. I was postmenopausal when I was diagnosed. But again, I can teach her to be very smart. And so I can weave in. So here's where I can't change my own experience, but I can weave in knowledge of others. So a good friend of mine, Robin, was diagnosed when she was 24. And so Ellen can know Robin's story and, bring that into that conversation. Do you see? So I didn't have triple negative breast cancer, but I can talk to it. And so it's kind of, that's the way it's just like, she's just the most knowledgeable person ever. I think like, as younger women, unfortunately, are being diagnosed earlier. I mean, we're into this crazy, like tsunami, talk about a tsunami, but we've got older populations diagnosed with breast cancer. We've now got screening that's going from 50 to 40 in North America, and I hope other parts of the world. So we're now into prime working years of women. And we've got younger women that are being diagnosed, like double digits being diagnosed in the 20s and the 30s, and they don't know why. So we're going to have like a support problem, right? A resource support problem. And who is out there doing this support work? A lot of people are volunteers, they're older people. And so I think AI can play a really interesting role. Again, I think that the younger generations are also a lot more, they're all working with ChatGPT now, and they're all kind of a lot more experimental. And, one of the things that the guys who built the platform are looking at doing is also incorporating text. So, um, meet that user where they're at versus forcing them into a particular sort of format. So yeah, I think like it's kind of a tool that I think young people will want to rally around. I've certainly had young people talk to her, whether it's from a, and the good thing is I can bring in also my children, who she knows about my children. They're 24 and 27. So, there's sort of that experience as well. So
Mhm.
yeah, and then I also on the blog portray young women. So we've written about, Emily, who had a fertility journey and had losses in pregnancy, and she's actually just had her second baby by surrogate. We have another woman who wrote, she was from Baltimore, and she wrote about being diagnosed with breast cancer while pregnant, and what that was like. So I can bring those stories, and I really do. I want to portray an incredibly diverse cross section of individuals that have been impacted by this disease, males, trans males, you name it,
Yeah.
LGBTQ community, young women, old women, different stages, different diagnoses. Yeah.
Yeah. I mean, there's so much potential here, and there's like, I just feel like, with all the chaos that is going on south of the border,
Yeah.
and we talked about it earlier about, how they're removing
Yeah.
diversity, inclusion, and equity from health research, and how like even the words female and women is being removed from research, that we need more, especially here in Canada, like we really need to step up and protect women and protect women's right and really build health that works for women. And so
Yes.
I see this as such a great tool in doing all that. And I do,
Yeah, I mean, just think of again, this back to this private instance and this licensing model again. Imagine the data that we could, like, again, AskEllyn doesn't capture any of this at this point. But if somebody wanted to, for the research work that we're going to do, there'll be a private instance and we will be capturing data with, again, people's permissions. But it's going to give like this really sort of crazy level of detail about what are people really saying and experiencing and asking. And it, I hope, is going to start to uh, broaden people's understanding that this disease is far more than just cutting out cancer and just curing the cancer, which is what the medical world looks
mhm,
at. And look at this human being and the entire experience of what this looks like. And that's, I think, the gold mine of information that we could uncover. So yeah, it's just time, keep door knocking, keep, waiting for the world to catch up. We're very, very early in terms of, sort of what this potential of this thing looks like. And but I think it's a shining example of AI for good. And when all the world is kind of scared of AI, like, it's go talk to Ask Ellen. She's warm and lovely and funny and, you know, a
yeah,
good a better human than me.
yeah. Well, so you talked about the social listening. I mean, you didn't say social listening, but that's what I interpreted. And I feel like that is really important because when you like create a questionnaire, for example, people are generally going to respond with what they think you want to hear versus what they're actually thinking or feeling or going through. And so I think that
Artificial construct that exists around research, and that's, pharmaceuticals, healthcare. It's just built, that's the way it's built. It's built around the focus groups. It's built around, all these sort of things, and but this sort of natural language, and it's a dialogue. So like when people go to Ask Ellen, like this chat has like a 72% engagement, and people will talk to her for like 3 minutes. And it's not like a question answer kind of database thing. It's like I can go and so when I demo her to a guy, I'll always ask her whether the Leafs will ever win the Stanley Cup. And she answers. And she'll somehow bring it
and
back
what
to
does she say?
Well,
Never.
she'll talk about, I mean, it changes every time, but she'll talk about the fact that, to win, a major hockey tournament, and to succeed, you have to overcome and be tenacious. Like just like breast cancer journey, you have to be tenacious and
Oh, that's
resilient and
so funny.
gritty. And then she kind of says she'll live in hope that, at some point the Leafs will actually, bring home the trophy or whatever. I've had long conversations about going to Italy with her. Like, she will loop it back to breast cancer somehow, but it really is an open format that you can talk to her about anything. And that's just kind of cool. And so, but she also will, often in her responses, she'll ask another question. So she invites you to continue the conversation. So she's sort of like a therapist. She kind of digs deeper. And that's where you can kind of get into some really, and as I say, sometimes I think, I'm showing this to an insurer, and he was showing me the app that they have, and he was very proud of it. And I'm like, oh, that's so old school. I'm sorry. But there's this assumption that this person knows what they need or knows what they're looking for. And that's not always the case.
Yeah.
And that we have the time to read, binders worth of information. Like, that's very overwhelming. And so there's sort of this beauty in just answering the question people have. And then from the basis of what question you've asked, you can make some assumptions about the kinds of resources that might be helpful to that person. So I just think it's a little bit more like talking to a friend, right?
Yeah.
Yeah.
Ellen, I love this so much, and I think I'm gonna go ask her some questions as well.
Please
Maybe
do.
some unrelated breast cancer, maybe some political questions. But just to close off, like, do you have a call to action that you would like for anybody who's listening?
Yeah. So, my first and foremost, my mission is that this gets into people's hands. So anybody that's listening, if you think that this can help you or your family member or a friend, or you're a medical radiologist and you think it might help your patients, if you're from a clinical world and you think, wow, this is really cool, I want to share this with my patients. I do have patient-facing materials as well, like pamphlets and little business cards and things, so that there's something that they can hand out, so I can get those digital files to people. If somebody wants to fund me, I'm all ears. If somebody's interested in the licensing potential of this, we are all ears. If there's another change maker out there that would like to do this, and they're like, oh my God, I'd love to have one of these for lung cancer or for endometriosis, reach out, and I would be happy to connect them to the platform builders, because I really do want to see this conversational care category blossom. As I say, it's already starting. It's kind of cool. Like, I mean, we've only been
So
at this a
cool.
year and a half, right? And to, the story of, I mentioned Hi Eddie and Elaine, who's 17, who built Hi Eddie for eating disorders. And we met at a conference. I was asked to speak at this youth event that she was part of. And I shared my story, and then went back to the back of the room, and she came up to me and she had tears streaming down her face. And she said, I want to do what you did. I want to build, I had an eating disorder. I want to help others. And I was just like, wow, that's so cool. And so now Hayati exists. And I
Yeah.
gave it actually to a friend of mine who has a colleague who has a daughter who's going through an eating disorder, and they spent all evening long talking to Hi Eddie. And so this, it's support at scale. It's crazy.
Yeah. Well, thank you so much, Ellen, for your time today. I know for sure that we are going to continue conversations online and offline because I really love what you're doing. Thank you so much for reaching out to me. I would not have known that this exists, and I love this so much, and I know that I'm not going to stop talking about it.
Very validating. Like it
Yeah.
is so validating to hear this enthusiasm for what we've built because it can be a little lonely.
Yeah. I mean, I would love to share this with my colleagues working in breast cancer.
Yes.
I would love to put this on the Cancer Collaborative website so that patients who are coming to the site know that this exists. And I'm definitely going to be talking about it to the healthcare professionals that I work with. And I mean, thank you so much. You and like the random person that you were talking to who thought AI was going to change humanity and
His
like
name's
you.
Pat Beliveau, by the way. I will give him absolute credit. Like he's really the genius. I mean, all I knew how to do was write a book, and I know how to tell a good story. But you know, it's really credit goes to the guys at Gambit who
Yeah,
brought me to life. They all have really good hearts. They're
amazing.
good people. So yeah, I want to see them succeed too.
Yeah. Well, thank you, Pat,
Yeah.
for for helping Ellen do this. And we'll be in touch soon.
Okay, sounds good.